Nous allons à présent inviter le docteur Tanchou Cabral à nouveau pour nous parler en 5 minutes.
5 minutes, c'est quand même excessif. Pas 5 minutes, non. Mais on a eu 1 heure de retard, je veux dire.
Qui va nous parler de current state of cardiostimulation activity in Cameroon. Are we following the international standard? Dr. Tanju,
thank you very much for this opportunity again. I'm seeing that there are some rhythmologists or electrophysiologists, people that are also implanting in this room. And probably, especially in Cameroon, probably they will also help me in with that question that is sounding there. The aim of the presentation is to present first the centers where pacing activities are going on in Cameroon, to report the pacing activities of the cardiac center from October 2010, and to check if really international standards are followed up in probably the cardiac center Chisson, because there are some centers in Cameroon, or that really I sent a paper with some a questionnaire that I didn't receive. And at least Professor Ngachu is here and he will help me. Next. The pacing centers in Douala, there are many. There's General Hospital, that the pacing is done on a daily basis. There's Kingue Mario, that is having also a unit of electrophysiology where really they are doing pacing. There's Clinical AV, where pacing also is done. In Yaoundé, there's Centre Cardiovasculaire Médical in Saint-Mélima. Unfortunately, the gentleman is not in the room. I thought he would be here. There's the Hôpital de Référence in Saint-Mélima that they are also implanting, of course, the cardiac center Chisson. Next. Our statistics, all cases admitted in the hospital, in the cardiac center for brady or tachypacing or for resynchronization therapy, we analyze the files. Next. Okay. The types of procedures that are done in this department: brady pacing, we did 205, tachypacing, we did 5, and cardiac synchronization therapy, we did 2. And we also implanted in children, few cases in children presenting with 6 sinus node and with pulses and syncope. That's why we are treating actually. Complete atrioventricular block, the first one, you see the P waves not followed by the QRS complex, atrioventricular dissociation with severe bradycardia. And also down is 6 sinus node and atrial fibrillation with low ventricular response. These are indications for pacing. If you see an EKG like this, it's meaning that you should really send the patient somewhere that he should benefit from a pacemaker. Next. The country of residence, they were patients coming from Nigeria, from Chad, from Democratic Republic of Congo, Kinshasa. Next. And in Cameroon, the Northwest region was the most represented, probably because the cardiac center is in that region, and probably because also they could pay for the pacemaker. Mostly dual chamber pacemaker were implanted, probably due also to the diagnosis. There are more patients with complete atrioventricular block and 6 sinus node than atrial fibrillation with low ventricular response. And not only that, we really followed up strictly the recommendations of, probably it's not good in our setting, recommendations of American Heart Association or European Heart Association, according to the fact that a patient with complete atrioventricular block should benefit from a dual chamber pacemaker. Meanwhile, a single chamber pacemaker also can go if you want to save his life, but we opted for the best for all patients. Okay, here we cannot see well, but on the left is a dual chamber pacemaker implantation with the 2 leads, one in the left, the right atrium, and the other one in the right ventricle. Really at the apex, this is how it should be actually. And on the right is a single chamber, the only lead in the right ventricle. This one is cardiac resynchronization therapy with, no, this is the ICD, sorry. the ICD, if you see the coil, and it was a single-chambered ICD, you see the coil at the tip of the electrode. And this is the cardiac synchronization therapy with the coronary sinus lead. Okay, during we see also the dynamics. You were talking about the cardiac, the crisis in the NOSO. Yes, yes. Since 2017, everything dropped till now. Till now. And as sister said, we believe that probably the future will be green and we'll have more cases. This is what we see every day. Popcorn and from all sides. Yes, there were complications, of course. One death, leak dislodgement, pocket infection, left-hand paralysis, and pneumothorax that were treated accordingly. Of course, that cannot be treated. But what was there, the leak dislodgement, the patient were taken back. Pocket infection, it was treated accordingly. Left-hand paralysis, the procedures were done accordingly, and pneumothorax that was drained. These are some publications that we did. Next. Yes, are we following international standard? I'm talking about the cardiac center. We know the guidelines and we follow up actually in the cardiac center, Chisson. Patients suffering from complete atrioventricular block are implanted a dual chamber pacemaker. The main problem can be financial limitations, where a single chamber pacemaker can be implanted in the place of a dual chamber to save life. And also probably the time frame from a diagnosis to implantation sometimes is too long. Probably in Clinique de Genève, des hôpitaux de Genève, probably there, if a patient is coming today and the diagnosis is done, probably the next day the patient is implanted. Meanwhile, in Cameroon, the diagnosis can be done today. The patient will be implanted if he's still alive, probably 4 or 3 years after. This is really one of our challenges, and this is what is making sometimes life difficult and is complicated. On that side, this is what I can say we are not following international standard. If not, we learned how to do these procedures internationally. And when we are coming back with all that knowledge, we just continue to do it as it is required. And meaning that we do follow those recommendations. As conclusion, now we have more pacing centers in our country that will permit us to save more patients. And the cardiac center is still working hard with innovations in pacing in Cameroon and publishing. The socio-political crisis slowed down all activities, but we hope for a bright future. And we think ablations will be included with the help of some people inside in this room. International standards are followed up carefully, but financial limitation leads us to, let us say in bracket, managing type of treatment. Thank you.